Hi, Dr. Reeves here. I'm a neurologist. We're going to talk today about something called conversion disorders. Now, a conversion disorder, depending on how you think about it, is actually a very common thing. It's often not referred to in those terms. Often people talk about stress symptoms and that kind of thing. A conversion disorder is when psychological stress is converted into a physical symptom or change. In one sense, we all have conversion disorders. If a car almost hits you, doesn't hit you, but almost does, if we check your blood pressure and your pulse, they're both increased immediately after that, because the stress of what almost happened has made a physiologic change. Your body has changed. Now, a conversion disorder can manifest in almost any way. Sometimes conversion disorders look like uncommon sort of neurologic type symptoms. A lot of people have conversion disorders that are much more kind of widespread and people don't get any heartburn about. For example, my conversion disorder is my stomach. If I have a lot of psychological stress going on in life, my stomach tends to hurt. Now, very important thing about conversion disorders, I'm not making it up. Okay, my stomach hurts, and I used to see a stomach doctor, and I take stomach medicine, or I used to take stomach medicine for that. And so now for me, if I'm having a lot of stomach issues, either I got some bad Mexican, or maybe I need to look at kind of what's going on in life. I've been working too many hours. How are my relationships? Am I processing some kind of issue from before? So conversion disorders, we know, are so common. If I said to you, I'm having a lot of headaches, and then we were talking and it emerges that I just got a new job, I just moved to a new town, I'm not really sure how things are going, where things are going with this new job, or maybe there's some other big relationship thing that has just happened, you would very reasonably look at me and say, well, Dr. Reeves, do you think your headaches have anything to do with all the stress that you've been under? Well, that kind of conversion disorder is pretty typical, pretty common, and nobody gets wrapped around the axle about that. If the conversion disorders manifest as seizure-like spells, people get a lot more wrapped around the axle, get a lot more upset, and appropriately so. Sometimes conversion disorders will manifest as, and this is just a very short little list. I've seen people who lost the ability to speak because of the stress. It doesn't take Freud to figure out how that might be linked. I've seen conversion disorders put people in wheelchairs. We know for people who have seizure-like spells that are conversion disorder, there are a lot of different terms or names that are used. Non-Epileptic Spells, NES, is one that I use because it sort of tells us that they look like seizures, but they are not seizures. Sometimes some people will call them non-epileptic seizures. Kind of don't like that term because now you're still calling it a seizure, but so that's a little confusing. There's an older term that I actually have a lot of heartburn about, and that's the term Pseudo Seizure. Pseudo means fake, and conversion disorder symptoms aren't fake. They are very real. The only question is, what's the engine driving the process? So when a patient comes into my office and they have any kind of symptoms, it could be tremor, could be seizure-like spells, could be tingling in their tongue, it could be, you name it. I'm always thinking, okay, this is a real problem. What's the engine driving the process? If they're seizure-like spells, is the engine epilepsy? Is there some kind of drug reaction? Is there some other kind of medical disorder? If it's weakness, say, in the legs, is there a spinal problem? Is there a muscle disease or something like that? So I want to reiterate, conversion disorder problems are very real, and they're not fake, and they typically aren't really kind of consciously under control. Very often, conversion disorder symptoms kind of spiral up. And it's uncommon that somebody gets to the top of the spiral, they're having a lot of problems, and they get to get on the elevator and just go right down to the bottom. Life would be much easier that way. We would all like to do that. Typically that doesn't happen though. Really, it's a process of kind of reversing the spiral up and trying to get things to spiral down, to sort of more move to where instead of the symptoms being in control of the person's more in control of the symptoms. How does that happen? A whole variety of ways. I'm not a psychologist, I'm not a counselor, I'm not a psychologist, but I can tell you that when I find a conversion disorder, which is hardly rare in my career, I always say we need to enlist somebody who can help you understand what's going on and help with the processing. If you take folks with seizure-like conversion disorders, NES, non-epileptic spells, about 2/3 of people have some kind of trauma in their past. The trauma can be some kind of abuse, physical, emotional, sexual abuse, or a combination thereof. Sometimes it's some other kind of trauma. And we're not going to talk today about subdividing all the different kinds of conversion disorders, short-term ones, long-term ones, and that kind of thing. But I just wanted to talk about the fact that conversion disorders exist. They can look like lots of different odd neurologic things. They are very real. They're not being faked. The only question is what's the engine driving the process and how do we try to put the brakes on that engine. So I hope this has been helpful. Thanks for your attention.